We have a guest in the studio today, Dr. John Gilmore, the Director for the Center for Excellence in Community Mental Health. And Dr. Gilmore, you're with the Department of Psychiatry at UNC.
Yes, I am.
Well, thanks for coming in today to talk about mental health issues. And let me ask you about a little bit of your background. How long have you been at Carolina?
I went to medical school here in the 80s and then went and did my psychiatry training in New York City and then came back. And I've been on faculty since 1991, so almost 25 years now.
So you came back, you didn't want to leave because you liked Chapelville so much, right?
That's true, that's true. I grew up in eastern North Carolina in Rocky Mount and wanted to see the big city and saw it and came back. So.
Well, I was in Rocky Mount for a short time, a long time ago. What exactly is the Center for Excellence in Community Mental Health?
It's part of the Department of Psychiatry, and it's focused on providing mental health care in our local community. We have a clinic here in Carborough, actually, outside of the hospital, so we are serving the community. We also have a clinic in Raleigh now. We've had a clinic in Raleigh for a couple of years as well.
I think a lot of people probably would be surprised to hear how many people have mental health issues or mental illness issues.
Yes.
How many are there?
There's a lot. I think some of the estimates say that almost 20 to 40% of people at some point in their life have a mental health issue.
What specifically are you working on as far as research is concerned, and what mental health issues do we need to be particularly aware of here in our community?
Yeah, well, I mean, I think there's a lot of things that we all need to be aware of and concerned about. Our center is focused on people with serious and persistent mental illness. We focus mainly working with people who have schizophrenia or bipolar illness, kind of the severe end of the spectrum of psychiatric illness.
You're studying all this in a systematic way, which I understand has not really been all that prevalent. I mean, there hasn't been that much research done in the way that you're doing.
Yeah. My personal research is we're interested in looking at very early predictors of who's going to go on to develop schizophrenia. So, usually by the time someone develops schizophrenia, we can treat it, but we can't make a huge dent in it. What we ultimately would like to do is identify people very early on and say, you're at risk for developing it. Let's do something now to prevent you from actually getting it. So that's my research is we're actually looking at very young children who have parents who have schizophrenia, so that they're at risk for schizophrenia, to see if can we identify kids very early on. Is there something different about how they're developing that would give us a clue as to, we need to do something very early here?
Well, as the song says, there's something wrong in the world today. There's so many things going on. It's a confusing, chaotic world in so many ways. This seems to be more prevalent these days, or perhaps it's just that we're hearing more about it. Are there, I don't know that many psychiatrists. Is there a shortage of psychiatrists in North Carolina and in the country?
Yes, there's definitely a shortage of psychiatrists across the country and in North Carolina specifically. Mainly in rural areas, more urban areas, bigger cities tend to have enough psychiatrists, but there is definitely a shortage.
There's the image that's been perpetuated in TV shows and movies. You go to see a psychiatrist and you lie on the couch. And,
right.
It's that kind of a session. How close to reality is that?
Not very close. There are people that still do kind of the classic psychoanalysis approaches, but most psychiatrists don't do that anymore. We talk to people, we prescribe medicine, we help people recover. There's a lot of things that psychiatrists do these days.
We're talking to Dr. John Gilmore of UNC Department of Psychiatry, and if there's someone who wants to find out more about excellence in community mental health, how do they go about doing that?
Probably just visit our website, which is unccmh.org, and you'll get all the information there.
Well, cool. Thank you very much for coming in. And this is something we could probably talk about for hours, but we have limited time, of course. And I know that you have a lot of stuff to do, too. So thank you very much for coming in on another hot day here in Chapel.
Well, thanks for having me. I appreciate it very much.
Dr. John Gilmore from the UNC Department of Psychiatry, Director for the Center for Excellence in Community Mental Health. It's 8:40.